So good evening and Johar. Welcome you all in 328th episode of this podcast series, Gyan Pravah. My dear friends, today really I am a little bit emotional. Emotional due to two reasons. It is my 11th podcast, and I am really, ma'am, when we started it, the way the confidence which we have, and today when I am doing a podcast, the confidence I have is just phenomenal. And ma'am, it's really because this is my last postcard. Ma'am, it's really, it will feel like a vacant that after each podcast, we are just searching for our next speaker and all. So, ये अब vanish हो जाएगा. So, really, ma'am, thank you so much for give all of us so many work, so many platform. So, thank you so much, ma'am. And as we all know, and definitely, I think the non-Foxian also know who is Dr. Sunita Tandulwadkar, madam. Ma'am is the present president of Fogsi, past president of IAG, president-elect of ISAR. And I always used to say, ma'am recently have the fellowship of the RCOG due to her tremendous work for the Indian women's and its upliftment. Man has the first, stem cell IVF baby at the age of 45 and whatnot. So thank you so much, ma'am.
Thank
Thank you.
you.
And
Thank you.
as and we all know that whenever we start, we always getting the blessings from our senior. So, ma'am, we start from your blessings. Over to you, ma'am.
Thank you. Thank you, dear. Thank you for your kind words. Even I'm going to miss every day 8 p.m. joining, but this is life. It has to change. And then only we'll have a value of what we had. Now we'll start brainstorming what we should do because it's going to be 351 episodes. We have a huge data, beautiful material, fantastic talks and discussions and dialogues of many faculty. Amrita ji, thank you so much. I
Thank
joined
you.
just for 1 minute. I have read your CV and I'm so glad about you joining and giving some time for a podcast. It will definitely add the value to our podcast. And Apurva, thank you so much for having Amrita ji with us. And also, uh, today, after your welcoming you, I will be just leaving and joining the viewers link, and you and Apurva only will be. By that, everyone will be listening to the podcast, and I will shut my mouth because I will be in a viewers link. So thank you so much. And Apurva, you are one of the most dependable, sincere, honest. You have become like a son. I have that much love and respect for you, Apurva. Very much, very much. You are very sincere from such a small city, from such a small state. The way you have vision, your work, probably your state will see the Foxy president.
Thank you.
So just dream of that, Apurva, and I will be standing very strong with you whenever you need me in any of your organizational journey. Maybe IAG, maybe ISAR, maybe Foxy. I'll be there because more than you needing that position, the organization needs the leaders like you. You are very sincere, very hardworking, very dependable. And I will miss you all because you people may not be there with me in ISAR. I'm taking over as a ISAR after 1 month of giving this, but it's beautiful journey. More than anything, the lifelong bond which I develop with you, I will always cherish them. Thank you. And
Thank you.
I will listen to you all from the other end. Thank you,
Ma'am,
Amrita ji, once more.
these words,
Thank you so much.
wait,
My
ma'am,
pleasure.
ma'am. I'm really, it's feel me emotional, ma'am. And I really, जब आपने बोला कि you are like my son, ma'am.
Whenever you
Thank
are
you,
in
ma'am.
a low phase,
Thank you.
go to this YouTube channel, go to your webcast, and you listen to these few lines, and when you will never have a low phase in life. Never, never.
Thank you. Thank you.
Thank you.
Thank you so much, ma'am.
Thank
Thank
you.
you, ma'am. Thank you so much, ma'am. Thank you, ma'am. So, my dear friends, she is our dynamic Foxy president, Dr. Sunita Tandulwadkar, madam. After the blessings of ma'am, now we will start our podcast for today. Now, today's postcard is really very close to me, because as a chairperson of the Sexual Health and STI committee, I have a lot of peoples, they who are working for LGBT, who are working for the marginalized, for the groups, for the peoples. But today, I have, and I really feel lucky, I have a person from that marginalized group who has the experience of 25 years of working and fighting for their rights. So, Amrita ji, first of all, see, today only she traveled just for 3 continents and 40 hours long journey. And she is down, but still she, joined. And thank you so much. I have no words to send my gratitude towards you, Amrita ji. And definitely currently she is the advisor of the alliance group, and working for the awareness of the lgbt, mainly the trans genders, regarding the hiv, regarding the infection. She has a lot of awards in her credits and whatnot. Ma'am, whenever I went through your CV na, I really feel inspired. And really, before we start our the formal podcast, I just want from you, because we are from a person, from a society. Even today, suppose that a child is born and it is they are thinking that is a trans, they just remove them from their life, from their society. So I really hats off to you, ma'am, or probably your parents or your teachers or your guru, who accept you as a open hearted. So I think your study, your whole life is an inspiration for all of us. So before we start, just I want from you that please tell me about your childhood, how it's all began, and so that we get inspiration from you. Yeah, over to you,
Okay.
Amrita ji.
First of all, thank you so much for having me here, Dr. Apurvo, Dr. Sunita ji. I really appreciate for having me, and you are doing great job. Thank you so much. So, talking about my childhood, I was actually born and brought up in a Bengali middle class family in Kolkata. So my school days was around 70s or 80s, and at that point of time, you can easily understand being a trans kid is so difficult, where people did not have any knowledge about LGBTIQ people. Hardly there were any agency or organization also who can, guide people like on that. And I could connect myself with the so-called socio-cultural identity who are known as Hijra or Kinnar, because they are also same like ostracized in our society. And when I could see that, they were like going on the street and people are throwing bad remark. At the same time, being a feminine guy, because I was a male assigned at birth, it was so difficult for me to get all these, bad remarks from relative, from society, from neighbors and everything. But one thing I had in mind, I was giving some self-counseling even at that phase of my life, that maybe they are not literate, maybe they are not doing some job, maybe they are just singing and dancing. That is why they don't know what is going on with them. That's why they cannot protest with others. Maybe education is a part that can help. So I actually, whatever problem I had faced in my school, in my college and post graduations as well, one thing had my mind that yes, I have to complete my education. And life is a learning process. Even today, I'm learning. I mean, I did an online course last year that was from the University on Washington, that is on global health and management. So I'm just giving an example that learning should not be stopped for anyone, because learning is a lifelong process. And the problem was very much there because I'm the only child of my parents, and my mother and father. I mean, I lost my mother in 2005. She was also, working as a school teacher. My father was also working in a government undertaking company in Kolkata. So in the Bengali middle class family, you can easily understand if there is a feminine boy is born or there's a masculine girl is born, how difficult it could be. Who wants to break the typical gender stereotype? You know, in our society, always we have put them in boxes. I mean, as a boy, you have to do this. As a boy, you have to take care of your family. You should go out, play cricket, football, all these things. Don't mix up with girls. Don't play with dolls, all these things, right? Don't cry in front of public. And at the same time, if you are having a girl child, definitely there are so many similar restrictions on them, like you have to come back to home early. I mean, you have to learn cooking, you know, all these things, because tomorrow you will get married, you have to take care of your family. So these typical gender norms are set already for everyone. I'm not talking about the trans people, but even for the cisgender people, there are societal norms are there, right? And when I am not fitting into that typical heteronormative behavior, when I'm not fitting in that biological male body which I was assigned at birth, right? And so it's a like daily struggle. I mean, I hope people can understand who have gone through this process, that your preferred gender role is something and you are carrying a different body. I mean, you are trapped in a wrong body. So, I mean, I think this is some most common problem we can see most of the trans man and trans woman. So that is a thing. I mean, the struggle and challenges in ongoing. And you know, if I look back, I mean, I don't know where to start actually. Yes, I have come across a long way, long way. I mean, I started my career in 2000. I was given the HIV/AIDS training on in 2000 only, and that was a 2 week long training. And slowly I joined the development sector, a couple of organizations in Kolkata, and uh, moved to an organization in 2014. It's called Alliance India. So now I'm still with them. In between also, I was working in another national level organization. It's called Sathi, Solidarity and Action Against HIV Infection in India. And I worked in many departments. Many department means not only in program management per se, but I am also trained mental health counselor. So I worked also as a mental health counselor as well. And I'm also into, like, I feel very much interesting. I have also made couple of films, documentary films on the trans people. And maybe some of you have seen already that I'm a trained singer as well. Bengali cannot live without Tego, right? So I learned Tego's song from a very eminent guru, Srimati Shujita Mitra. And then um, we also came out, Avibhakti Foundation and Jivan Trust, they came out with a country's first transgender music album. There were trans singers, all trained, singers were transgender community, and we sang in that particular album from different region, from different culture, from different language. So, the main thing is that if I give you a very quick summary of my, this long-term journey, I realized that the world is not a bed of roses for people like us. When you are hitting the gender barriers, when you are not feeling comfortable, whatever is imposed on you, then the life will be miserable for you. And you have to struggle every moment, not only with the outer world, but also with yourself. What is wrong with me? Am I the wrong person? All these things. So first of all, I think knowing self is the most important part. When I know myself, what I am, who I am, then only I can express that to the outer world, right? And then it comes the roles of the family, the caregivers, the school, college, even at your working place. Then you can spread the awareness. But most important thing is that we have to know ourselves. We have to identify ourselves. It's not necessary that you should have to put into your boxes as a male, as a female, as a trans person, or any other identity. But you should know how you feel comfortable dealing with things, how you feel comfortable dealing with self, what is your preferred gender role, all these things. So I think that is a part, and I would like to request to all of you. I mean, if some of you are working for the LGBTI community, this is the thing. Maybe you can tell them, guide them that if you are aware about yourself, if you are aware about your own rights, your own human rights, and definitely what is a like guidelines, the laws and acts are there for people like you. Now, I'm very happy to say our current government is also very, very much helpful. We know that we have this Transgender Person Protection of Rights Act. That's a very bold act now. And we also, read down that IPC section 377 that was in 2018, I think, yes. So now people who are from the marginalized community in my country in living in a positive atmosphere. But also one thing is that like changing the laws, changing the act will not change the mindset of the common people. So awareness generation is the ongoing task. This should not be stopped. And where it's most important. Maybe you want to cover it in your other question, but I think education sector is the very, very like a fundamental criteria for all of us. When you have a like child in your family who is not like so-called identified as a boy or a girl and something else, and he or she is getting a very abusive treatment, not only at your family but also at the school, misgendered also, and then definitely they lose hopes from their lives. So that is a reason there's a huge rate of dropout among the transgender students, among the other sexually uh, ma- marginalized people. So I think school level awareness is absolutely important. This is something definitely. And then coming to the other service areas, there are so many departments, so many organizations. So, I think all those should be trained. At least the basics of human rights, basic of gender, basics of sex, sexuality. Then only I think we can see the world from a very different per se, that no one is like big or small, everyone is equal. And definitely we have to understand we should not judge any people. That is a message definitely I want to give through your podcast, that everyone should be judged based on the skills or talents we are having, not from our gender identity, not from our sexual orientation. um, because at the end of the day we are human being. Yeah.
Absolutely, it's wonderful, and you have really came a long way. So, Amritji, you have seen that, and you have told, that the school are the one places create awareness. But I think the family is the first.
Yes.
If they get the support of the family, then definitely, they can fight with the world.
Yeah.
So, and I feel that you are one of the luckiest one who get the support. Is true that you are getting the support from your parents, from your mother, or
No.
what? Yeah,
No, even that has got a long story actually. So you can well understand. I mean, if you are a Bengali person yourself, I know. So
yeah,
you
absolutely.
can well understand in a uh, so-called Orthodox family, Bengali family. And then at that point of time, I'm talking about 70s and 80s, you are having a child who is not a so-called normal child, and he is born as a male, but thinks I'm using the pronoun she, that she's a girl. So it's very, very difficult. Definitely, my parents were very, very much upset. Relatives were very, very much upset, and every time I mean, I had to fight for them. I mean, fight against them for to prove my existence. That no, I'm just like a normal, person like you. But they also got definitely some complaint that, I mean, your son is not a son actually, take him to the doctor. So all these things, uh, Bengali couple who is literate, who is working, it's very difficult for them to get all those comments, and it was very difficult. But at some point of time they actually gave it up. They actually gave it up because they understood that this is something they cannot change. Even they tried, this is something very, very much deep rooted in me. So even they tried, this is not going to help. So the thing came like this. I can well remember In 2003, my first, newspaper article, I was interviewed in Kolkata only during some Walid's Day event. I was interviewed, and my interview got published, and I showed that to my sorry, I showed that to my mom actually, that this is the work I do for the people living with HIV or marginalized people, all these things, and I also belong to a particular community known as transgender. My mom told me, "You are our son or daughter, wherever, that we know very well. And I have seen you growing up wearing my saris." Actually, I was into corsets when my mom went to school. Then I used to wear her sari. So you don't have to tell me that who you are, but our most, fear is that when we will be not here, who will take care of you? The society doesn't want people like you. Your relative do not understand. So that was their problem. So even they could understand my difficulties, my challenges on, but they were also helpless at certain point of time, right? Because there was no protection from the society. There was no such friendly act or law like we are having today. Similarly, in 2008, my documentary film, named it From the Third Eye, that I interviewed transgender and hijra activists from 8 states of the country, and that was screened in International AIDS conference in Mexico. And that came in either Times of India or Hindustan Times with my picture and everything, mentioning my pronoun as she. So I showed that to my father when mom was not there. My father also told me the same thing. The kind of work you are doing, it's absolutely good. There is no doubt, but you have to take care of yourself. Or maybe you can do all this work when you are outside of your family, because it's very difficult to make everyone understand your relatives that who are you or what kind of work you're doing. So I got that kind of a silence acceptance from my parents. I got to know, yes, they want to help me, they want to support me, but because of certain restrictions, I mean, they are also helpless at some point of time. So they didn't tell me any time that you should go out of this, environment. You should go from Kolkata. And no, 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 no. Even today, I have a very good relationship with my father. I used to see him like once or twice a year. So whenever I get time, I go to Kolkata. He knows all about my work, everything. And then also 2014, I started my transition process, both medical and legal. So that also got over in the 2 or 3 years. So that was also another part of my life. So everybody knows everything. Some relatives, they are not very happy with it. I know, I'm sorry to say, one of my uncles, when he comes to know that I have gone through this gender affirming surgery, he stopped talking to me. But still, I have some cousins, brothers, sisters, and they are very, very much, opening and helpful. And I can well recall that one of my cousin brother, when he came to know about this surgery, this medical process, he told me that, "Oh my God, such a painful process, why didn't you call us? We should be there." So the thing I have learned from life, you cannot make happy everyone. आप सबको खुश नहीं कर सकते. That part you have to understand. आप अगर किसी और के लिए कुछ करना चाहते हो, yes, you cannot change the entire world, but at least you can do something for some people, right? That much definitely we can. I mean, if you make a little change in someone's life, so I think that is your biggest award. And God has blessed me with that. I have my community members who loves me, and I'm working for them until the last breath of my. Definitely, I will continue to do this. And I mean, this is a thing that everybody is not happy, so called, or everybody has not given that much of like facility, privilege from the society. And in like Asian countries like India, and even I am today in a very safer place if I compare my country with other neighbor countries. Even United States, where trans identity has got banned, there is now two identities, male and female. So such a progressive states, I mean, like USA. if they are going back. And in our country, where we have a very rich tradition of history of the trans people, LGBTIQ people, everybody knows. You go to Konark, Khajuraho, and all these places, and definitely you can think
Yes,
about
yes.
Raman, Mahabharata. There are so many characters, and the
Mahabharata. Yes,
yes,
absolutely.
absolutely. And you also know about the Ardhanarishwar, the half
Hmm.
Shiva and half Shakti.
Shiva and
So
Parvati.
yes,
Yes.
the problem came when these British people came to rule us. They brought this colonial rules, but thank God that we have crossed this phase. But definitely, you are absolutely right. The struggle begins from the family first. So first, when we are starting to identify ourselves, then definitely you have to consider your parents first. If your parents understands you, if your parents loves you, that much of support is actually is a game changer for people like us.
Absolutely. It's wonderful. It's really a very wonderful discussion. And those, I think it's a really inspiration story. It is a story of that people are saying now, I am failure, I am failure, and nobody is there. I think you made yourself not only from within you, but inside the family as well as outside. So definitely it's an inspiration for all of us. Now coming to our topic for today, the topic is actually that it's our pride, it's our health, it's our own. So it's our right. So the first thing which when we are talking the healthcare system, because you are working from them for the marginalized group, so what type of difficulties you are finding, है ना, when we are coming to the health of that people, and pertaining it to the in general health, pertaining to the STIs, pertaining to sexual dysfunction.
Hmm. Absolutely, sir. Okay. So first of all, I would like to, clear some kind of a preconceived notion. Preconceived notions means whenever we are talking about the particular word health, we mainly mean or we mainly refer to some kind of a physical illness, right? But it's not that. It's much beyond that. We have to understand when we are talking about health, the overall health actually include my mental health, my physical health, my social health, okay, my emotional health, my sexual health. So there are so many types of it and so many, subgroups actually. So if you are really thinking to, work in the healthcare sector or, like giving some kind of a healthcare related facility, definitely you are a doctor yourself. You know that if someone is coming to you, he is very, very much mentally sick. He or she might have some physical problem, but as a doctor, you also have to identify what's going on in his or her mind, right? Then only you can really treat her in a proper way or him. So this is a thing. I think so. If we can divide this health part, like if we are talking about the mental health part, definitely stigma, discrimination is everywhere for people like us. I mean, because I'm working in the HIV field, so I know it's not only LGBTIQ people. There are other people as well. I mean, think about people who use drugs. Think about people who are sex worker. Think about people living with HIV, and definitely people like us, I mean, who are the LGBTIQ people. So there are already marginalized, right? And if you have come across with someone from marginalized community who is also living with HIV, then the stigma gets double.
Great
Okay,
double.
so the this is a sexual health part, definitely, but also the mental health is equally important. Y- and nowadays that we are into a different, era. So we are trying to identify, we are trying to integrate healthcare services with existing healthcare system, right? So if a person living with HIV, or if a trans woman or a gay person, whoever is coming to you, I mean, definitely it's your responsibility. If even if he or she is coming only for HIV related care or stay, services, you should also able to give him or her other kind of health care, advice or reference. And other part is that we also have to understand that in our country, if we particularly dealing or taking care of transgender people, Now we have a Transgender Person Protection of Rights Act. So I think this is the responsibility of any kind of a caregiver, whether you are in education sector, healthcare sector. The apart from your ongoing task or job, you can also ask them, have you registered yourself in the National Transgender Portal? Okay, and we should understand why I need to register myself as a national transgender portal. I mean, I got my transition done long before that, but even I am registered there, and because I have to spread this message to the community, to the stakeholders, to everyone. The National Transgender Portal gives us the opportunity for the transgender people that if you are getting a transgender identity card or a certificate, then you can definitely ask for temporary, shelter home. You can ask for educational scholarship. You can ask for now also even this transgender, Ayushman Bharat TG Plus cards that are health insurance card that's also cover the gender affirming care, all these things. So our government is doing very, very good job, all these things. But the thing is that whether we know all these things, whether do you have that much of awareness that even you are working for the transgender committee, for example, then definitely we should help them to get their name uh, 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 registered in that portal so that they get all these services. Yeah.
Absolutely. And you know what you have told, it's really because I am aware of this, I am dealing with this. Even I was not aware that these type of things are there. And it's a wonderful because even the third gender are getting an equal opportunity. So definitely, yes, it's really wonderful that you have bring out a very, very important point. Now, uh, when we are talking about health, after that, the main problem which I feel, is somewhere the STDs and HIVs are more common in these marginalized groups. My interpretation is there. So, because you are associated with that, you are advisor in the Great Alliance organization. So, just what's your view in that? The number one. Secondly, is the treating of those infection in those groups are same as when we are talking about the others like male or female or the other genders per se. Yeah.
Okay, so the thing is that actually, and also I'm coming to your question, but before that, I actually forgot one more thing to, give you information on. That is gender affirming care, which you used to note. हम लोग पहले जिसको बोलते थे किसी ने sex change किया. Now it's known as gender affirming care. It's a package of like when the trans man or trans woman go through these processes, it can be hormone. Replacement therapy. Now we known is that gender affirming hormone therapy. Also like surgery, like d- if I talk about genitals reconstruction, there are facial surgeries. There is like voice therapies. All these things are part of gender affirming care. And we also have a guideline on this. It's called Standard of Care version 8, published by WPAT, World Professional Association for Transgender Health. If you go through the Transgender Act, there also it's mentioned by the government that the all the healthcare sector they have to follow if they have to take care of the transgender people. They have to follow this guideline. And like to give one additional information at Alliance India. We are closely working with AIMS Delhi, All India Institute of Medical Science, and we have a help desk there. There we are helping our transgender brothers and sisters to get this facility. I mean, since last year, we have been able to help like more than 180 transgender people on, I mean, who wanted to, go through these services. And why I'm giving you information, I feel this should not be missed, that because self medication is a very dangerous thing. So if I'm a transgender person, I can see there's another trans person who is taking some kind of a hormone without going through proper endocrinologist or the proper medical track testing and everything, if I take decision on my own, it harms my body, and it does. So that's why I think whenever if we are think about some kind of a change, bringing change to our body, definitely we have to think about the particular medical expert to uh, go for. Now coming back to your question. Now people, I was actually telling you that people who are into marginalized, um, groups or community. If I talk about LGBTIQ people, sex workers, there is already a stigma, right? Even like I can give you a couple of example also, because time to time we have to interact with the community. We have to do some kind of a different research on these areas as well. So even after all these things, I mean, yes, things are changing, but there are still, I mean, healthcare sectors. I mean, if I am a like sex worker and I have got this information from someone, I'm not naming anyone. If I'm a sex worker and I'm going to any kind of a healthcare system, the person who is supposed to give me care, he suddenly asks me, "Oh, you are a sex worker. What is your rate? When do you do sex work?" So things like this. When people know that you are in a difficult position, not all of them, but some of them take to get that advantage as well. And the thing is that it's not happening only for the people who are in sex work, but people living with HIV. They are also facing lots of stigma. And definitely, I should advocate on another thing. Yes, there very recently there has been a like decision given by the Delhi High Court. I mean, you have maybe seen that people who are living with HIV considered with that people who are with disabilities. That is absolutely wrong. Okay, if you go through the HIV/AIDS Act, there's an act in our country as well. That was in came in 2017. Yes, it's a very bold act talking about there should be no discrimination against the people affected or affected by HIV. So even after having that bold act, how Delhi court can take this decision, I'm really very surprised, because there are so many organizations like us who are working in this field, involving the community, and for the community, definitely we have to, this is a very critical setback for us. So this is another area. I think it should be changed absolutely. And coming to the healthcare part, actually, I think as a healthcare provider, one thing I should definitely try to talk about that, please don't be judgmental. Please don't be judgmental. You maybe have your misconception or anything, something like that. And but simple, if you are really going to give that, if you, proper care for someone, suppose you are a doctor and I'm a transgender person, I'm coming to you as a patient, okay? And you don't know my preferred gender role. You are addressing me, Mr. You are addressing my pronoun as he. Then there definitely it will be a shock or sad thing for me. I will not come you to you for the second time. So I will like isolate myself. Even there is service available. So this is a part. So I think there I would like to give an advice. If you do not understand someone's uh, like uh, uh, gender identity, whatever, for your documentation purpose, maybe simply ask them that, may I know your preferred gender role? Do you have any other name m- behind your official name? How I can address you as he or she? These will make like fill the gaps, and definitely I will be very much happy. People will be very much happy, because when you do not have that, communication is a very important thing, right? We even says that silence is the best communication, but the communication can do miracle things. I mean, if you are a caregiver and you are very well known theoretically at your field and all these things, but you are very poor at communication, that is not going to solve the purpose. So definitely we have to improve our communication. I mean, how I can give the surveys and all these things. All those things are written in your medical books, medical guideline, that if this is the disease, give this kind of a prescription. But even beyond that, as a human being, as a caregiver, how you are behaving with someone, how you are showing minimum respect to someone, that actually matters a lot for these people who are already marginalized. I think that is the part definitely I would like to give emphasis on. Yeah.
Absolutely, very correctly said. And major problem which as a gynec or as a doctor, what we are thinking that probably when we are seeing the patient of the marginalized group along with the normal, they are also normal. I mean to say the normal gender, the male or the females, probably they are not comfortable. What our feeling is that, and probably the third gender will be not be comfortable, or the male or the females, the other are not comfortable. So this is one thing which we always have in mind. But you have correctly said that creating awareness is very important. And don't be judgmental first, and secondly, don't be assumptive. You don't assume that. Please be frank and ask them. Probably that will be open up a window of talk between you to the healthcare provider as well as the healthcare recipient. And then definitely probably they will be very comfortable to tell their problem, with the healthcare provider, and it will definitely solve the problem much more. So it's very correctly you have said. And so we are talking about the doctors. So let as a working for the rights of marginalized group, I just want to ask you what your views, what you want that we doctors should do this so that it will help to those peoples which are often neglected. Yeah.
Absolutely, absolutely, absolutely. See, the thing is that nobody is perfect. That is the first thing I will like to tell you. Nobody is 100% perfect. And I was telling you that life is a learning process. So entire life we are learning, then there is no interfering. And there is no shy. We don't have to feel shy. Definitely, everybody is not expert on every topic, right? Everybody has his individual area expertise. So as a doctor, definitely as a medical caregiver, you are an expert, definitely. But yes, if you have to, see it from the lens of humanity, from the lens of equity, mutual respect, that is very, very much important. Otherwise, you can't treat your, individuals or patients, whoever is coming to you. So I think that is the part. And if you do not have, coming to your questions, that if you do not have any kind of information about these marginalized people, I would like to suggest that there are so many organizations, the civil society organizations, there are so many community based organizations. Now there are government departments also, trying to help. For example, I was giving you example of AIMS at Delhi AIMS. We have a center of excellence for transgender healthcare. So similarly, you can reach out to such people, you can reach out to such organizations who are already working on them, to know more about the challenges they are facing. There are already so many guidelines are there. I was giving you an example of a WPATH standard of care. So even you can go through all these things. And even after getting all this information from expert, from organizations, from the community, I think the main, keyword I will like to, give thrust on, that is openness. We have to make our mind open. Like in the being in the field of why doctor? I mean, think about people who are in legal uh, profession like police or lawyer. Even they have to say follow the same protocol, right? If you are in the service area, if you are a teacher, a doctor, a caregiver, whoever you are dealing with people every day. Then if you don't know their pain, the challenges they are facing every part of their life, every second in their life, then how you are going to help them, right? So if someone is coming to you are not, I'm not saying you that you have to become a god, you have to take care of everything. No, but you have to, understand at least what kind of a background, the challenges, the struggles he or she has been gone through. Then you will be able to give better guidance, better suggestions. Even, I mean, it's in the medical fields also. It is very, very much important. For example, suppose I have some normal. I no this particular I have a problem with this word normal because during my post graduation course I can easily recall that there was a teacher who was telling us who invented this was normal. It's human being, definitely. So at that point of time, how we could define what is wrong and what is right? So the normal was itself is a very contradictory world. What is normal for you may not be normal for me. You might be liking white rose. I might be liking red rose. That's absolutely fine. Think the world, get the world, see the world from that perspective. I mean, if I give you an example of a heteronormative couple or a cisgender couple, the so-called normal couple. We don't ask them, right? What we have been doing last night in your room, right? Then why you are taking unnecessary interest for people who are marginalized, like LGBTIQ or sex worker, whoever? So this is a perception. We have to change our perception. We have to, make ourselves, our mind little bit broader, where everyone can be accepted. Acceptance is a very, very critical thing, crucial thing. If you are not accepting someone as a human being, then you cannot give the service properly. That's a major thing I want to say.
Absolutely, absolutely. You very correctly said that yes, and it is not only to give the service, but it is also to, make awareness and make that feeling comfortable. Probably that's we human being are. So that is the thing. Yeah. So I think after that, just I, because probably we also don't know about what the government is doing. And you told Amrita ji ki government is actually doing a lot of things for the marginalized group. So what the government is doing?
Okay, so let come one by one. If I talk about HIV per se, definitely I was telling you about the HIV/AIDS Act, and also like you must be knowing in our country, HIV treatment, testing, everything is given free of cost. That is given all the government hospital. So but the ART center, and there is also so many other project. If you know about this national AIDS control program, there are Shampurna Suraksa clinics. So there are different programs actually dedicated or supported by the government itself, and in our country we can get the ART drug free. Now, there is one or two suggestions, because I am also associated with UNAIDS Program Coordinating Board. Now, there are a couple of countries in African region. They have, they have tried this rollout of this one long-acting antiretroviral. So that is also another area. I think government is already considering this, and maybe in coming 1 or 2 years we can see also rollout of LARV in our countries as well. So, and there are so many organizations also that are supported by TIs. Now TIs mean targeted intervention. So we have HIV/AIDS targeted intervention program that can be done by community-led organization or CSOs, NGOs for typically these marginalized groups. So there are TIs for the transgender people, there are TIs for sex worker, there are composite TI. So throughout our country, there are so many targeted intervention program, and through these TTIs, actually, people can get testing, treatment, everything at absolutely free of cost. That is one part, and then if I talk about the other specific healthcare for the transgender community, I mean, if I talk about, I was giving you information about this Delhi AIMS. Now there are other aims also, and at Alliance India we are also giving awareness sessions to different aims in different states. That Delhi aims have already started. Maybe you also consider to start at y- your state. That is one part. And definitely like if I talk about sex workers, earlier in our country, being in sex work was also similar, like almost like it's penalized. I mean, as being a sex worker was not legally authorized. Supreme Court has also changed that sex work is also a profession now. The other thing we are struggling with now for the people who use drugs, that is only one punitive law still there in our country, and I know definitely this will also be worked on. So in short, I mean, people who are infected or affected by HIV, if I talk about LGBTIQ people, If I talk about people living with HIV, sex worker, whoever, there are many targeted intervention program, government program, dedicated program, and there are so many other services also given by the so many CSOs are there. They are also working on that, like Alliance India. There are so many other organizations. They are also, uh, supported or closely working with the government. For example, I can will recall, yes, that the National AIDS Control Program Phase 4, the transgender specific, transgender intervention program TI, that introduced in National AIDS Control Program Phase 4, in NSP 4, and I was also there in the working group. So there also we identified like why transgender people should be given special care, because they have so many other things, other challenges as well. So that is another part. Definitely, I will have to talk about that. Government has different working groups in NACO. Also, there are different like technical working groups. I'm also associated with NACO for the transgender technical working group. So I mean, they are constantly, trying to help us that what are the problem, challenges, all these things, what else that can be done. But yes, definitely, if I talk about HIV, it's absolutely, testing, treatment, everything is free in our country. And now also there are community support center. Even those are now being taken care by the government of India, where they can be given some kind of like short-term care or specific care for the people living with HIV and other marginalized groups. So this is a very, basic or a very rough picture. One thing definitely we must have to also, I definitely should address this. As you know, that because of the funding cuts by United States, there are so many donors who are now able to not being able to help us, right? So this is also bringing very critical side effect of the community work, the engagement, intervention, everything. So now I think definitely we should also think about public-private partnership. We have to think about how we can get involved more CSR opportunities. There are so many private entities also, if they can also come in the picture and they can think about the okay, public and private, entities, they can work together. I think now we have to explore. Yes, there are things are going on, but these things has to be scaled up. Yeah.
It's wonderful. And actually, government is doing a lot of things. And I think when the government is doing, we as a society should also do for these groups. And they equally deserve all the respect in all forms, in a forms of giving healthcare, in a forms of giving treatment, in a forms of giving the counseling. So thank you. It's been wonderful discussion, and I think it's a ever-ending discussion. But yes, the time is always short, and definitely goodbye is not the goodbye, but it's actually the beginning of something hello. So, Amrita ji, it's really I think this podcast is an eye opener for me also, and definitely for our viewers also, that how important and these marginalized groups have all the rights to have. We don't need to, be kind to them, don't give, at least think about that they are also human being, and give those respects and rights what they actually deserve. I think that is the main thing, main nichore or the take home message from this podcast.
Absolutely.
So thank you so much, Amrita ji, and thank you so much for joining even after in your busy schedule, and even after traveling for almost 40 hours in flight. You are still there in this with your choked, yeah, the Thor, yeah, with sore throat. You are still there. Thank you, thank you, thank you so much.
Thank you
And
so much. God
thank you.
bless you all. Thank you so much.
Absolutely. Thank you so much. And absolutely, this all podcast is the brainchild of our dynamic Foxy president, Dr. Sunita Tandulwadkar, madam. And it's really, really, really thank you so much, ma'am, for always giving us all the supports. And definitely our technical team. And all because this is my last podcast for today. For actually not for today, but for this is my last podcast under tenure of Dr. Sunita Madam. So I really thanks to all the Vinod ji, the Kripa, the Pradeep ji, all the technical team for always being with us whenever I want live or whenever I want recording. You all are there. So thank you to all of you, and definitely we will catch. And thank you so much, Amrita ji. Definitely we will catch you physically as well as virtually in the near future. Thank you